Hello, everyone, and welcome to today's webinar. This is Channel Vision editor Gerald Baldino here, and today we're very excited to welcome Phone.com for a presentation on providing innovative communication solutions for disrupted business environments. Today we'll be speaking with Joel Maloff, who is Senior Vice President of Strategic Alliances and Chief Compliance Officer at Phone.com. Please stay tuned for a Q&A session at the end of the webinar. If you have any questions during the presentation, you can submit them through the Q&A portal located at the bottom of the Zoom platform. At this point, I'd like to turn the webinar over to Joel to begin. Joel?
Wonderful. Gerald, thank you very much. It's our pleasure to be here. This is an interesting and timely topic for Phone.com. So what I'd like to do is just start with a little bit of background. As everyone knows, the way people work has changed dramatically over the last 6 months. Even before the pandemic, COVID-19, businesses were starting to change towards a more distributed yet interconnected workforce. The disruption that COVID-19 has created has made this situation urgent, and it's accelerated the opportunities for telecommunications agents, value-added resellers, managed solutions providers. There are opportunities out there. And so what we'll be talking about today are the work from anywhere solutions for today's agile, mobile, and always on businesses. Before I jump into some specifics and give you a little background of myself and Phone.com, I thought it would be useful, instructive, to talk a little bit about some numbers. As an example, the U.S. Bureau of Labor Statistics in June of this year indicated that 43 to 45% of American workers or work occupations were suitable for work from home. That's interesting. When we think about it, there are many occupations that aren't. Doctors, nurses that have to integrate directly with people or interface directly with people. That same statistic said that as of June, 22 to 25% were actually doing so. But it differs from industry to industry. The ones that are most suitable for work from home would be management, business, and financial occupations. Think about it. You've got people that are dealing with finance, but they can work from home. They don't necessarily have to be in an office. The world is changing. How do we address this? Some of the other areas that are suitable for work from home are professional and related occupations, consulting, those sorts of things. Office and administrative support roles, IT, finance and accounting, education, healthcare, public administration. So there are a lot of areas that we might be able to help. Another study from Stanford University indicated that as of right now, 42% of the US workforce is already working from home, and that post-COVID-19, only 26% would actually be returning to business premises. I don't know if I believe that or if I agree with it, but I can tell you that I think commercial real estate is in for a rude awakening after all of this. I wanted to share a direct anecdote from Phone.com. In early March, when COVID was first starting to take hold, the Chief Technology Officer asked me if maybe we ought to think about whether or not we as a company could work from home. We have over 100 employees, and we started to look at it, and we created a business continuity plan. We decided that we needed to check, make sure that all of our employees had proper computing capability, proper networking, that they had a space where they could work from home that was quiet and would allow them to perform. We found all of those things out, and then we decided on a Tuesday to test it. We did, and we have not gone back. And so that is an example of how we've implemented business continuity, disaster avoidance strategies internally. We do that with our partners. What we are looking at is a new paradigm for business. Effective methods of communications are more essential than they have ever been. Phone.com works with our channel partners to identify, implement, and support innovative ways to communicate. That is what this webinar is all about. We're looking to be able to identify how we can work with those organizations that are currently our channel partners or might be interested in working with us as channel partners. So let's move forward and see what we have to cover. Just a little bit about Phone.com and myself. The company has about 40,000 business customers. We've been in business since 2008, delivering services. Initially, we were providing hosted PBX service, and now we've evolved into unified communications as a service. And the purpose of this presentation is not to give you a commercial about Phone.com. We think we have a lot to offer. We really want to talk about value. We offer voice, we offer video, we offer texting, SMS and MMS. We have integration with other platforms and collaboration tools. We were built for the small to medium-sized marketplace. We have customers from 1 or 2 people in an office up to several hundred seats in a single location. We have an inventory of more than 20 million phone numbers. We are device agnostic. We do provide devices like Yealink, Polycom, Cisco. We also have soft phone capability. We also have mobile apps. And the last one is of a special interest to me. We are HIPAA compliant. And as you'll note on my title, I am also the Chief Compliance Officer for Phone.com. We became compliant about 3 years ago. Notice I am not saying that we are HIPAA certified. There is no such thing as a certification authority for HIPAA, but we are HIPAA compliant. We go through an audit every year. We train all of our employees, and we'll talk a little bit about the various markets that we serve a bit later on, but healthcare has become a very important one to us. Let's move on. And I wanted to talk a little bit about the different channel partner service delivery models that we have. When I first came into Phone.com 10 years ago, I was expecting, when I was creating the channel partner program, that it was going to be primarily what we used to refer to as systems integrators. We now today refer to them as managed solutions providers. That was true. There were many of those, but there were also different models that we had not anticipated. The first that I'm going to speak to is a trusted, unbiased advisor. We'll then move into the expert consultant, which is really fairly much the managed solutions provider. Then we'll talk about enabling technology and expanding into communications, unified communications as a service and value-added resellers. And then lastly, application developers and how we're working with them. So as a trusted advisor, this slide is intended to indicate just how confusing the marketplace can be. If you imagine you're a small accounting office, you've had a phone system that's been in for 10 years, you want to get something different. What do you pick? How do you find something? You can do a search on the web, and yes, you're going to find all of these and many, many more. What a trusted advisor does is they can come in, they can identify through all of this sea of confusion what it is that your specific business requires. They can determine which of all of these different solutions might be the best, and they can make recommendations. Now, we have trusted advisors as part of our channel partner program that choose not to take any compensation from us. The reason for that is that they want to represent themselves as impartial. They don't want to be beholden to a specific vendor. We're happy to work with them. We have quite a few that do that. But in most cases, these trusted advisors aren't necessarily going to have deep product knowledge. They're not necessarily going to be providing tier one support to their customers. They are a trusted advisor, and they assist in assembling a solution for a specific set of customer requirements. Then we get to the expert consultant, value-added reseller, MSP, managed solutions provider. These organizations, and some of them are just one person, some of them are a team of 10, some of them are much larger than that. They have a deep understanding of the various technologies that are out there. They are then able to match the product features, functionality, and configurations to a specific client's set of requirements. The client is getting a semi-custom solution where the MSP, the expert consultant, is determining what best suits their requirements. For most of these organizations, they will be receiving a commission or a fee relationship with the vendor. And yes, phone.com does have that, and I'll talk a little bit more about that in a few moments. I thought it might be useful to step back for a second and explore for these managed solution providers, value-added resellers, what are some of the solutions that they're coming up with? So we've talked to many of our best partners, and here are 3 examples. One of our solutions partners has helped a client that had 3 Mexican restaurants to set up call queues to handle the influx of takeout orders that were coming in during mealtime. I live in South Florida. We are one of the hotbeds for COVID-19. The concept of takeout, home delivery, rather than being able to physically go into a restaurant is very big here. Well, let's think about that for a second. So we might say, well, in the past, if they had 3 restaurants, they could have a group of people sitting in the restaurant or a headquarters answering calls. But that's not the case anymore. Where are these people who are handling calls located? Well, most likely they're working from home. And so by exploring what the requirements were, by setting up the system so that the call handling rules would be able to address the call queues, so that they would go to the correct people, so that they would have the ability to take those calls, take the order, and deliver during the rush of mealtime, was something that this particular partner was able to do, and very effectively. Then we get to the second one, work from home scheduling challenge. This is somewhat related to the first, but imagine using call handling rules to route calls to remote workers based on availability schedules. So now, again, these folks are still all working from home, but we know that Joe is going to be on at 11 a.m., Mary is going to be on at 12 p.m., and Sandra is going to be on at 3 p.m., and we know when and where to route these particular calls by time of day, day of week, or even by holiday. We can have specific schedules set up. The idea is that some of our customers from phone.com have a need for high volume calling, both inbound and outbound calls. We have what are called unlimited extensions. You have an unlimited amount with normal business use, and there's no overages. But then you've got others that don't have that high a demand. You might have a phone that is in a library, if we were back in the normal world, or you might have an employee that doesn't take a lot of calls, working from home. We can use what are called metered plans. They might have a bundle of minutes that the organization shares. In this way, the value-added reseller and managed solution provider can create a solution for that particular client or customer that ensures that they're only paying for what they need. That's the flexibility of the system, and one of the advantages that our channel partners have in understanding how our services are delivered. Then we get to a little more complex area. This is where we have enabling technology packaging. You'll see that we've listed one of our channel partners here, iTherapy. iTherapy is involved with mental health professionals. I mentioned earlier that we are HIPAA compliant. And so what iTherapy does is they are assembling best of breed services, a mix of relevant applications that they then sell to their clients. They might be psychologists, therapists, psychiatrists, and all of them are associated with, in this case, mental health. They do the setup, they provide support. Yes, Phone.com is providing that to iTherapy, but iTherapy is providing the package to them. Now, one of the interesting elements here is that I mentioned that I am the Chief Compliance Officer. Within a healthcare environment, there is a requirement for what is called a business associate agreement that avows that the vendor is following HIPAA, and there's also regulation called high-tech following those. So I have to sign a business associate agreement with each of iTherapy's therapists because I am working with them to provide the phone services underneath iTherapy. There are two different types of business associate agreements. One is for the healthcare professional, like a psychiatrist. That is called a covered entity. They are creating protected health information that needs to be protected. The other is a business associate, and that might be an organization actually like iTherapy, that they themselves are not creating any protected health information, but they're handling it. A billing company, a management company serving the healthcare industry would also fit into that. So when we think about enabling technology packaging, there are different verticals that each have unique needs, whether it's dentists, I mentioned therapists, accountants, real estate, construction, landscaping. All of these can have customized solutions, and our channel partners, like iTherapy, are the ones that are putting them together. We work with them to provide our part of the underlying service, but they are offering this as solutions to their clients, whether it's unified communications as a service, customer relationship management, CRM, email, accounting, web hosting, security. Do we do all of those? No. But can you assemble them into packages? Certainly. So then we get to application integration. Anything can use voice as a service. I have 4 that we've listed here. The first, All Pro Web Tools, is designed as a CRM for small business. Instead of having to go to a Zoho or Zendesk or Salesforce.com for a small accounting office that has 4 or 5 people, that might be overkill. So All Pro Web Tools has created a solution that is targeted at that end of the market. How does Phone.com get involved? Well, we integrate directly with All Pro Web Tools so that the phone portion is included. And so when they provide service to their customers, their clients, whomever's using their CRM, they have access and create an account with phone.com to use our phone services as part of it. Chrometa is an interesting one. Chrometa has to do with time management. I remember many, many years ago when I was doing independent consulting, I had a program on my computer that tracked my time for each of my clients. Well, Chrometa is time synchronization. And again, you have the ability to integrate the phone services that we provide with their packaging. I'm going to come back to LiftMaster in a second because that one is unusual. PieSync does something similar to Chrometa, except it's not time, it's contact records, syncing across all different apps. And again, we have the ability to incorporate phone services into those areas. LiftMaster is interesting. If you've ever gone up to a gated community and there is a box that you press a button to dial the resident to ask for entry into that community, LiftMaster has 80% market share in the United States for those kind of devices. We provide the underlying communications so that when you press that button, it actually goes out over phone service. It's not a typical phone service. It's not someone sitting there answering the phone. It is an integration where we have enabled LiftMaster to be able to market to their various customers. So what's the bottom line? Disruption equals challenge and opportunity. I can tell you 4 or 5 years ago when we were considering whether or not we should become HIPAA compliant, the way that came about is that one of our customer service people was asked if we would sign a business associate agreement. We didn't really know what that was. We investigated. We realized we could either look at this as an administrative pain or as a business opportunity. We chose to go the latter. And the same is true now with all of the disruption that is happening with business. There are many ways that value-added resellers, managed solutions providers can recognize current needs as opportunities. It's very important that the business model match the customer requirements as they have evolved today. I don't know if phone.com will ever fully go back to all of our employees being located in physical buildings. We're finding ways to make this work. We are helping our partners do precisely that as well. So the opportunity is there. The phone.com channel partner program is designed for value-added resellers, managed solutions providers that want to increase revenue from both existing clients and customers and new clients and customers while saving money. We do offer commissions. One of the approaches that we take is that the commissions for those that wish to take them, and as I mentioned earlier, not all do, those commissions are paid on a monthly basis unless they're very small, and then we'll pay them on quarterly or semi-annually. But we pay them for the life of the customer. And so it's not as if there is a limited period of time, you have 1 year and that's it. No, we don't do that. We want you to be engaged with that customer to the degree that you want. Our services are easy to implement. We can get your clients or customers up and running in minutes. You don't need telecommunications knowledge. We'll help. I'll talk about that more in a moment. We have sales tools, marketing assets, and training that will work with you. I have a team that we call our preferred support group that is designed to assist our major customers and our channel partners. If you have a prospect, you can come to our team and you can say, here's the opportunity. I need some help putting a proposal together. We will absolutely do that. So this is the kind of approach that we take. And we believe very strongly in innovation and working with our partners to achieve that innovation. Again, our support team will help you delight your clients and provide exceptional service while earning those evergreen commissions. I like to point out that we will do as little or as much as you want us to. So for example, if you have a client administered deployment, your customers administer their own accounts in our online control panel. You don't want to be involved in the day-to-day management, modification, adds, moves, and changes. Great, we can do that. We will still pay the commission and work with you for bringing those clients and customers to us. At the same time, we have channel partners that want to do everything. We have a control panel that you would have access to through our channel partner portal that would allow you to see all of the clients that you've brought to us, and moreover, have the ability to navigate into that client's configuration. We have many channel partners that charge their clients a management fee for being able to do that. So if you have clients that are technophobes, don't want to deal with it, you can do that for them. We don't charge anything for that. That is part of the service that we provide. Again, we like to say we will do as much or as little as you would like us to. So let's talk really conclusions. Let's get started. The opportunity out there is enormous. Businesses need your help. I like to think that of all of the businesses out there in the United States today, there are probably half of them that don't even know there are alternative communication solutions. They may have what we used to call an old key system. They might have an old PBX. They might be using trunks from one of the major carriers. They don't even know that there are other alternatives. They're not going on the web searching for VoIP phone systems. You know how to do that. You can look at their needs. You can help them save money and perform better in today's client. We talk about three things: transformation. Consider innovating the business models for meeting those emerging customer needs. How can we work with you to help transform what you've been doing or supplement what you've been doing? We integrate. Anything that connects to the web can be a phone. It can use phone data. We have mobile applications for iPhone and Android, for tablets. We have soft phones that can be used on a computer. We pride ourselves in collaboration. And again, integration and innovation. These are the things that we like to do, that we get excited about, and that we can bring to both you and your clientele. Those are the major points that I wanted to cover. I hope this has been interesting to you. Please let me know if there are any questions.
All right. Thank you, Joel, for the great presentation. At this point, let's open up the floor to questions. Just a reminder that there is a Q&A portal at the bottom of the Zoom platform. If you have any questions, just submit it through there. Let's start off by talking about security and compliance. What security and compliance issues should MSPs and VARs take into consideration when recommending solutions?
So those are great questions. The question is security and compliance. And let me talk about them in the same vein. From a security and compliance perspective, I get a great many questions from people as to whether or not some functionality is compliant and is considered secure. You might question in a telephony environment, where is there the potential for exposure of protected health information? Well, what about voicemail, text, fax, call recording? Any of those could contain information that should be secured and is considered protected by HIPAA. And so we have the ability with our system to disable the sending of a fax attachment or a voicemail to email. We disable those, and that is important for compliance. Another one that comes up is whether or not texting is compliant or secure. Our recommendation is that for the most part, it is not, unless you are using an end-to-end encrypted environment, which most aren't. We recommend that healthcare organizations do not accept text. We have gone one step further than that, and we have created an autoresponder. So we have quite a few healthcare companies that if you attempt to text them, you will automatically get a message that says, "Thank you very much, but we do not accept texts. Click here for our privacy policy or call us at this number." In that way, they never receive the text, and the patient or the person that is trying to contact them knows that that is the case. I don't know of anyone else that's doing that. We don't charge for that. That's something that gets to our ability to innovate solutions. Overall, security, we do have the ability to provide secure SIP for end-to-end encryption for voice services in both our standard services and in our mobile apps. So we are addressing those. I didn't mention, by the way, I'm actually a doctoral candidate in cybersecurity. So when you ask me about security questions, I get very excited. Next question, please.
Love it, love it. That's one of our favorite topics here. Now, Joel, the pandemic has caused a major uptick in video usage. Can you talk about a little bit about the increasing importance of video in business communications today?
Yes, absolutely. Phone.com does have a video service that we introduced about 4 or 5 months ago. We have seen a considerable uptick in usage, and that somewhat relates to the prior question with how do you assure that a video session is secure and private. The service that we are offering has the ability, once you have established a session, let's say it's we've got 4 people on the session. As the moderator, I can then click on a button that locks the session. No one else can get in. So you don't have the same issue with Zoom bombing of someone getting into it or someone accidentally joining a session before the prior one is concluded. Our video service also has the ability to have a custom password so that in addition to having to know the link for the video service, you would have to have a custom password to be able to get into it. It does have call recording capability. I don't recommend that for the healthcare customers, but that is encrypted and secure as well. So we are seeing a considerable growth in that video service. Next question.
Okay, another pandemic-related question for you. Has the pandemic had an impact on Phone.com's ability to support customers and partners?
Excellent question. So the question is, has the pandemic had an impact on our ability to support and really grow customers? It's actually been the opposite. What was, I think, eye-opening for us is that, as I mentioned earlier, we did go to a work from home environment very, very early in March. We did not miss a step. My entire team is remote. I have 7 people that report to me that support our channel partners and major customers. We've actually increased our executive meetings where we are able to work more closely together. We use tools like Slack so that we have Slack channels for various areas. If there is a technical concern, someone can post in the Slack channel. If there is a need for someone from the customer service team to transfer a channel partner over to my team rather than coming in directly, that's easy. We do that. I honestly, my boss would probably hit me in the head, but I think we're better than we were before. Next question.
Okay, are there any specific vertical industries that are most promising right now?
So, as you can probably tell, I think healthcare is one of the most important ones for all of our partners to be looking at, whether it's a dentist's office. And by the way, one of the largest fines ever issued for violations of HIPAA was to a dentist's office. It was several $1 million. That is not something to sneeze at. In addition to that, legal, again, great opportunities. People don't necessarily have to be in one location. Real estate, very big opportunity. Finance and accounting. Also, small government, state and local government. All of these are looking for solutions that if you as our channel partner, as a value-added reseller, were able to put together a package like iTherapy did or like All Pro Web Tools does, you will have considerable opportunities for those people that are out there that don't even know they need a solution. You will be able to help them. Next question.
Okay, I'd like to conclude here by talking a little bit about compensation and how that works for channel partners.
Sure. The channel partners, if they choose to, will receive a commission from us. We have a starting percentage that we use, and then as their monthly recurring cumulative revenue increases, we increase that percentage. Again, that is for the life of the customer. There are no sunsets for the commissions. We do pay those commissions on a monthly basis, unless it's just starting and it's a very small amount. We'd rather not be paying $2.50 out. So we save that for the quarter or for the half year. We have some channel partners that will bring us 1 or 2 customers, and then their business model changes. They might not do anything for several years, and then all of a sudden we see them becoming active again because their business has again changed. We will continue to support them. In addition, we are very open to working with our channel partners in terms of promotion. I've offered to many of them, if you'd like to do a webinar like this, but targeted at your clientele, we'll do it. Let's work together and find ways that we as Phone.com can support you as our partners. Next question.
Okay, I think that should wrap things up here. Big thank you to Joel and the entire Phone.com team, and of course to all of you for attending today's event. To access this webinar on demand, please head over to channelvisionmag.com/webinars. Also keep an eye out for an email from Channel Vision, which will contain a link to the presentation. Stay safe out there, and we'll see you next time. Take care, everyone.